At this time, the chair lays out HB 1535 and recognizes Chair Click to explain the bill.
Thank you, Mr. Vice Chair. In 2015, I had the great honor of creating the Compassionate Use Program to make low THC cannabis available to patients with intractable epilepsy in Texas. This was a narrowly drafted, very focused bill designed to give people with intractable epilepsy another option when others have failed. My intent was then and still is to have a truly medical program that follows the scientific data. Last session, we passed HB 3703 that made some improvements to the program and added several conditions, including multiple sclerosis, terminal cancer, and autism. This session, 1535, proposes a few additional changes. It adds 5 conditions. It includes all cancers, not just terminal, chronic pain that would otherwise be treated with an opioid, PTSD in veterans, and medical conditions in the research program and debilitating medical conditions defined by Department of State Health Services. HB 1535 creates a medical cannabis research program under HHSC. For us to truly know if this medication helps other conditions, we have to have more data. With the promising results we've seen in some of the data and with our state-of-the-art research facilities in Texas, we are well suited to participate in this research. And finally, HB 1535 raises the THC limit for low THC cannabis from 0.5% to 5%. This is needed to assist in distinguishing medical cannabis from hot hemp products. This would enable treating physicians to find the best balance of cannabinoids for each patient. I'm open for questions and reserve the right to close.
Members, are there any questions for Chair Click? If there are no additional questions, we will proceed with testimony. Folks, let me remind you all, if I can, and I think Chair Click explained this, but let me reiterate it. We have a lot of bills today. We have a lot of witnesses. So we're going to stick to a strict time limit, as mentioned and stated by Chair Click. Please do not repeat your testimony. And again, if you have written testimony, please don't get up here and read it. We can read that. If you'll hand it to the clerk, she'll make copies, she'll get that to us. We want you to speak from your heart. I'd like to hear from you. And again, we ask not to please not read your testimony. At this time, the chair calls Craig Dubois. Doctor. Please state your name, your position on the bill, and who you represent.
Yes, thank you for having me first this early morning. My name is Craig Dubois. Either pronunciation is okay with me. I am a board-certified neurologist, also board-certified in pain management, and have practiced here in Austin about 30 years, and totally about 38 years from training. Since 1990, I have been 95% focused in painful conditions as a specialty of my practice. And back then, there was only one other person who was doing part-time, so I saw what I like to say is some of the hardest cases. As part of...
Excuse me, doctor, again, are you representing yourself?
I'm sorry, that was my next line. I am here speaking for myself in the interest of my patients and future patients, and I am here speaking in support of House Bill 1535.
And I apologize for the interruption, but we have to keep the record clear. Thank you.
Yeah, somebody told me that, and it's just, I got going glib.
That's okay, I do it all the time.
All right, thank you. And you may notice that I have bloodshot eyes this morning, and it's not from using anything, except that I forgot that I put habaneros in the guacamole last night, and when I put my contacts in, I remembered. Yeah.
Well, and I have bloodshot eyes because I was up all night with various committees. Thank you.
Yes. My whole purpose, I think, is doctors treat patient symptoms. We make diagnoses as a useful indication, but we really are treating symptoms, and symptoms spread across the board. Headache is part of migraine, it's part of concussion, it's part of PTSD. Very often we have to treat the symptoms that we see and use the tools we have. As I said, when I started in the 90s, there weren't a whole lot of tools, and we were using all the anticonvulsants and antidepressants as extensions, trying to do something, manipulate the chemistry in the brain to help the people. And they had a lot of side effects, as you can well imagine. We used to call it Topamax, Dopamax, because everybody got goofy, myself included, when I tried it for my migraines. Couldn't remember where I parked my car. But the key issue is I consider that the acceptable use is a very good first effort, the acceptable use list, but its conditions, and I am so much more oriented towards what symptoms do you have and what can I do to try and alleviate those conditions. I don't think we can distinguish why one type of pain might be more appropriately treated than another. There should be no prejudice in what pain is coming from, except that it is.
Doctor, again, I apologize. We're on a strict time limit. You have about a minute left.
Okay. I think the key thing also is that the ratios of CBD THC are very important, and I believe it takes physician knowledge of the chemistry and how that works and the indications. I have tried working with that, and you have to adjust. I think I'm very much in favor of raising the limit to 5% so that you can reduce the volume instead of somebody having to take a huge volume to get to an adequate dosage of it. And I think that I like to tell patients that I'm like a Sherpa. I've been on this climb 1,000 times. This is your first and hopefully only pass through this moment. But we can give you guidance. And then, while the opioid experiences were bad, we did have ways of monitoring. We learned very much that people can monitor it. And patients don't want to be cognitively suppressed. They do not want to be in a haze. And most of the older patients, particularly with arthritis, are very much interested in something other than more Motrin types, and they're not interested in opiates, and have expressed very strong willingness to consider this under a physician's approval.
Thank you,
Physicians
Doctor.
have been limited.
At this time, the chair would like to recognize that Representative Weiner is present and on the dais. Thank you. Thank you. Members, any questions for the witness?
Thank you. Thank you.
Thank you, Doctor. At this time, the chair calls Mary Kerr, MD. Again, please state your full name, your position on the bill, and who you represent.
Good morning. My name is Dr. Mary Kerr. I'm a medical doctor. I'm here speaking today on behalf of myself, and I am in support of House Bill 1535. I'm a board-certified physical medicine and rehabilitation specialist and completed a double residency in internal medicine and physical medicine and rehabilitation. I'm fellowship trained in functional medicine and been in private practice in the Dallas-Fort Worth area for 19 years. I've seen firsthand the transformative power of cannabis in my patients who are currently eligible under Texas law, but I've also been faced with agonizing conversations of those that are just as deserving that have not qualified for treatment. I've dedicated my life to caring for people with neurologic conditions, spinal cord injury, chronic pain, traumatic brain injury, and stroke, to name a few. Some of my patients include people who are injured on the battlefield, both mentally and physically, while serving in our military, and also public servants who've been injured while protecting our communities. Some patients are living with, through, and beyond cancer. And it is not just the patients who are affected by these devastating conditions. Their caregivers put forth tireless efforts to maintain a quality of life for their loved ones. Both in medical research and in my own clinical experience, cannabinoid therapy has been shown to improve symptoms related to these conditions in a way that no other substance has done before. It has also been scientifically proven to have a profound impact on seizure disorders, pain, anxiety, and PTSD. However, the current law allows me only to prescribe to terminal patients with cancer. Cancer, pain, and symptoms are not exclusive to those who die of this disease, and in my clinical experience, medical cannabis is more effective at relieving these symptoms than other pharmaceutical drugs. It is also an alternative to dangerously addicted opioids, which the vast majority of cancer patients face taking during some point of their treatment. The opioid epidemic was a problem before COVID-19 and now is accelerating. Texas faces a historic spike in opioid overdoses, with close to 4,000 deaths in Texas in the past year.
Doctor, we've got about a minute left.
On the first day of medical school, we were told as the class of 1997 to do no harm. I've taken the oath of Hippocrates and sworn to do this for my entire career. Unfortunately, the Texas law has not allowed me to completely follow my oath, and I believe that I may have done harm by not being able to prescribe medicinal cannabis to some of my patients. I'm asking that lawmakers open their hearts and their minds. House Bill 1535 is a significant step in the right direction. It gives me as a physician the ability to prescribe life-changing medications to patients living through all stages of cancer and who may have otherwise needed opioids. My call to action today is to begin to serve these patients with love, honor, and dignity by allowing their physicians to prescribe the needed therapies to improve their quality of lives and the lives of those around them. I stand next to you in serving your constituents in the best way possible. I pledge to you that I will continue to serve to the best of my ability and do no harm. Please vote yes to House Bill 1535.
Doctor, thank you so much for your testimony again. And you did a wonderful job because your written testimony was right at 3 minutes. But we do ask everybody, please, if you have written testimony, please turn that into the clerk and speak from your heart. Members, any questions?
Thank you.
Thank you, Doctor. At this time, the chair calls Mike Thompson. Hello. Please state your full name, your position on the bill, and who you represent.
My name is James Michael Thompson. I'm for House Bill 1535. I'm here representing myself, the newly formed Texas Cancer Survivor Coalition, and hundreds of thousands of cancer patients and survivors all across Texas.
Thank you very much.
I'm a born and raised Texan. I'm proud to say it. When I was a kid, I walked the hike and bike trail with Ann Richards. I've ridden bikes with Rick Perry. I've engaged with countless lawmakers through biennial celebrations and work engagements through my professional healthcare endeavors. And I stand before you humbly asking for your help. I do want to comment on Representative Click for being a champion for this legislation. Despite the iteration in the last legislative session, including the word cancer, I'm still not eligible for medicinal cannabis. When I was young, 10 years old, 1995, I was diagnosed with acute myeloid leukemia. To condense the version of my story to fit this 3 minutes, I'll give you the Cliff Notes version. For 5 years, I endured 4 cancers, over 75 surgeries, 2 bone marrow transplants at Cook Children's Hospital in Fort Worth, wonderful institution, and a 12-and-a-half-hour facial reconstruction. My time battling cancer ended in the year 2000. In 2003, a secondary surgery damaged the nerve. I was placed on pain medication and went to MD Anderson every single month for 5 years. Not a day went by that I didn't take a narcotic, a neuropathic pain medication, an anti-inflammatory. Cancer may have taken 5 years of my life. Being stuck on pain meds took an additional 6. Despite of all that, I went to a detox center. Luckily, it was covered because it was cancer related. And I met firefighters and police officers and doctors and nurses and lawyers who were all suffering from the same problem I had because of the paradigm of opioids being the only remedy for chronic pain. I came back to Austin from Kerrville with this newfound passion for life, despite the chronic pain still being there. I had overcome hearing loss from toxic chemotherapy. I had overcome infertility and the fact that my wife and I were not going to have kids, but the pain was still there. Despite my cancer journey, I became active again. I made it all the way to the Ironman World Championship in Hawaii in 2012. In 2015, I summited Mount Kilimanjaro, and I started raising money for various cancer nonprofits. After working in healthcare and raising money for various nonprofits for the last 10 years, I decided I'm going to go back to school. Opioids caused me to withdraw medically from school my freshman year in college.
Mr. Thompson, you have about 30 seconds. I apologize, but...
That's fine. I have to thank my wife for this because she inspired me to go back to school. I graduated in August with honors from Concordia University, and I start my master's at Texas State in the fall. My question to you is, what could I have done with those extra 6 years if I wasn't stuck on opioids? I am for House Bill 1535 to expand compassionate use so that the physicians that preceded me in their testimony can prescribe effective, safe remedies for chronic pain so that people like me, the hundreds of thousands of cancer patients and survivors across Texas, can return to life.
Thank you very much. Members, any questions?
Thank you very much.
Thank you for your testimony. Have a good day. At this time, the chair calls Jason Walker.
Do you want to let these people be on deck?
What?
Let these people be on deck, know that they're next.
Please state your name, your position on the bill, and who you represent.
My name is Jason Walker. I represent myself, and I'm on the bill. Jason Walker. I'm a disabled veteran. I'm a combat veteran. I was diagnosed with PTSD 2015. I've replaced 10 pharmaceutical medications with cannabis. I'm in here to plead with you to remove the cap. 5% is not medicine for PTSD. I'm a veteran. I've done the research on myself. I'm looking you in the eye. It's not gonna work for PTSD. And this is what I worry about. People like myself, whenever I was on all those pharmaceuticals, they led me to suicide. I had a suicide attempt. There's gonna be veterans, it's gonna be their last thing that they're holding on to, and you're gonna tell them that this is gonna work for their PTSD. And whenever it doesn't, they're gonna commit suicide and they're gonna kill themselves. And that's gonna be on you because you won't remove the THC cap. Remove veterans from the bill, because I believe that you're gonna redefine what PTSD means, and it's only going to apply to veterans. First responders and everybody else in this world can get PTSD. It's not just veterans that have been to combat. And a lot of our PTSD comes from childhood trauma that's not been treated. And then we go to combat, and that gets exacerbated. And then we come home, and nobody wants to help us. I served 20 years in the military. I was a senior NCO. I'm a Bronze Star recipient. I served in combat more than once. And I'm sitting here pleading with you, begging you. And I'm gonna leave you with this. If TCUP was such a good program, then why isn't the rest of the United States adopting programs in their states to parallel what the TCUP program is? You got one person, compassionate cultivation, that sits here and makes this byproduct. It's not medicine, because 0.5%, what is the other 99.5% that's in this? It's a byproduct. You got patients right now that have IG tract problems because they have to take so much of the oil. Veterans, I'm a 20-year veteran.
Mr. Walker.
You know how much, I understand I got a little bit of time.
I'm sorry.
But as a veteran, 20-year veteran, we take all kinds of medications. Our livers are done. Our stomachs are done. I don't take pharmaceutical medications any longer. I don't drink alcohol. As you see, I'm not fat. I could still exercise. Please do what's right.
Thank you so much. Members, any questions? Thank you, Mr. Walker. At this time, the chair calls Amanda Walker. Please state your name, your position on the bill, and who you represent.
My name is Amanda Walker. I'm representing myself, and I'm speaking on the bill. I'm going to read. This is my first time, so bear with me. I'm going to try to stay on track and stay under the time limit. My husband is a disabled veteran who was diagnosed in 2015 with PTSD. He uses cannabis to treat his PTSD and many other ailments that he's received during his 20-year career. While the passing of this bill, he would qualify for the program, the TCUP program, but like many others won't benefit from it due to the THC cap and the limits on consumption. It's important to understand that medicine works differently for everyone. You can't sit here and tell me that 200 milligrams of ibuprofen is going to work for every single one of you every time. You got to take 2 sometimes. Our military members are very aware of that 800 milligram ibuprofen, so we all know that there's a range, and it's important that we understand that it works differently for everyone. We need to look at cannabis as medicine, and please not be fearful of what we don't know or understand. Cannabis really saved my husband's life. I'd be standing here as a widow speaking to you if it wasn't for cannabis. I appreciate the opportunity for the veterans to participate in the TCAP program and are hoping for expansion on the limits and the qualifying conditions. Thank you so much.
Thank you for your testimony. Members, any questions? Thank you.
Thanks.
This time the chair calls David Bass, Major U.S. Army, retired. Please state your full name, position on the bill, and who you represent.
David Bass. I'm testifying on the bill. And what's the third one? Oh, I represent myself.
Thank you.
Thank you for this bill, Representative Click. I know that TCAP is currently helping patients in Texas. I got to tour Compassionate Cultivation. I was very impressed with what's happening there. But the reason I'm testifying on the bill is if your bill passes, I'll become a TCAP patient because I've had 3 cancer surgeries in the last 5 years, and I'm a 25-year veteran with PTSD and chronic pain. But the reason I'm testifying on the bill is I use cannabis as medicine now illegally, and I use 1/2 gram 3 times each day in a portable vaporizer instead of taking opioids and psychotropic medications. And I've been doing that since 2012. And it takes care of my PTSD and chronic pain and helped me very much after my cancer surgeries. And so I'll be glad to be a TCAP patient, but I hope that we will raise the THC limit because I need 20% THC. That's what I use every day now at flower. And then my other issue is that I have PTSD, but my PTSD is no different than a firefighter or a police officer who has PTSD, or a person who was abused or sexually assaulted. Their symptoms and experiences are the same as mine. So I hope we can raise the THC limit, and I hope that all patients in Texas can qualify for TCAP. Thank you, Representative Click.
Thank you for your testimony. Members, any questions?
Yeah, I have a question.
Dr. Olafson?
Major, thank you so much for first of all, for your service to our nation, and also, I should say, also thank you very much to Sergeant Walker for his service to our nation. I'm just trying to understand, so I think you pretty eloquently talked about how you're currently managing your PTSD, and I'm very sympathetic to what you're saying. However, I'm just trying to understand, so this bill would propose to raise the THC limit from 0.5% to 5%, which is a 10 times, I mean, that's a pretty significant increase.
Yes.
But what I think I'm hearing you say, as well as what I heard previous witnesses say, is that that's not sufficient to treat PTSD, so we would rather not be included in the bill, even though what you're currently doing, at least in Texas, is not a legal treatment under state law. So this would bring you into legality, but not at the level that you want to be brought in. Yeah. So you'd prefer to continue to operate in the shadows, so to speak, or I'm just trying to understand the logic.
Well, I want to become a TCAP patient because I want to use the TCAP medicine and see if it helps me.
Okay.
But my experience is, since 2012, using 20% THC every day 3 times a day instead of the pills, it's perfect. It takes care of my chronic pain and the PTSD and helps me after cancer surgery.
Okay.
And so I want to try the TCAP medicine, but my experience is 20% THC flower is what I need and what has worked for me since 2012. But I'm open, to TCAP.
Okay, so you're saying, and I don't want to speak for you, but I just
Yes,
want to
sir.
make sure I understand. So your perspective is that you're content to have the bill pass, except that we quibble about the percentage content,
Yes, sir.
but you don't necessarily want to be carved out of the bill because if it passes without the content you're looking for.
Right.
Okay.
Yes, we want all patients with PTSD to be included.
Right, okay. Yeah, I'm just trying to understand because I guess there's a thought process that I thought I heard, which was it would be better if you just didn't include us in this bill if we can't come in at the level we want. And I don't know if that's going to be on the table. So I'm just trying to figure.
No, I think that, I don't think that's the case.
Okay.
I think that a lot of veterans in Texas, I know personally hundreds of veterans all over Texas going all the way back to the Korean War who use cannabis. And I think a lot of them will be eligible for TCAP, but they won't become TCAP patients because they prefer to keep using what they're using.
And from your perspective, you don't think that the fact that this TCAP program includes PTSD precludes you from being able to continue to do what's been working for you?
I think I could do both.
Okay, and I agree. I
Right.
think you could
Yeah.
too.
I think I could do both. And maybe, now here's the other thing. I also know hundreds of veterans in Texas who need to use cannabis but don't because they don't want to break the law or they have a job that they can't use cannabis. But if they could become a TCAP patient, I think that will help them, even at 5%. And so I think this opens the door for a lot of veterans in Texas who don't want to participate in the illicit market, but they'll be thrilled to be a TCAP patient.
Okay. Thank you, sir. Appreciate your testimony.
Did I make it clear?
Absolutely.
Okay, good, thank you.
Members, any other questions? I want to thank you for your service to our country. Sir, thank you for your testimony.
Thank you.
This time, Chair calls Dr. Robert Marks. Please state your name, your position on the bill, and who you represent.
Thank you for having me. I'm Dr. Robert Marks. I'm for the bill. I represent myself and millions of Texans. I stand before you. I'm a board certified, actually double board certified pain management physician practicing here in Austin. I've been studying medical cannabis since it was my fellowship grand rounds topic in 2011, 2012. I've participated in the TCUP program. I have about 40 patients that are on the program. I get great feedback, and for what it's worth, I'm extremely grateful for Representative Click and all of you guys for what you guys have done so far with the program. I've spoken with thousands of healthcare providers. I speak with my patients about cannabis. I speak with everybody about cannabis. I used to think that it was just going to be an interesting topic for discussion when I decided to learn about it in my grand rounds, and ultimately learned how much efficacy it could actually have, the impact that it could have on society in terms of being able to help mitigate the need for so many different types of medications, including opioids. We know that there's decreased incidence of opioid overdose deaths, and decreased incidence of prescriptions, decreased use of many different types of medications in patients that utilize cannabis. I think we all agree and recognize that you can't die of an overdose of cannabis. We know this. Doctors are scared to talk about this. We're scared of getting in trouble with the board. We're scared about somebody trying to make an example of us, having conversations about it. But I can tell you, doctors definitely support this. It's in all journals. It's in all specialties of medicine. It is a medicine, and doctors know that. Healthcare knows that. Even general society knows that because people read. Your constituents read. Everybody in this room reads. But yet we need legislation to further support that and allow us to be able to do our jobs as best possible, at least. We know that it's inevitable. We know that we're surrounded by states that have legalized cannabis, whether it's recreationally or medicinally. We know that a lot of geriatric patients are coming back, not even realizing that they're breaking the law by bringing something back. People go in summer in Colorado. I got senior citizens that come back all the time and they tell me, oh yeah, no, I found this great cream for my shoulder and it's finally, I don't need to take the anti-inflammatories. And I look, I'm like, you realize that's a felony, but they're doing it and they're not intending to break the law. They don't even know they're breaking the law. The indications, increasing the indications for what we're talking about, it's fantastic. I know, 30 seconds. It's fantastic to increase the indications, and I appreciate that. I want you guys to recognize and understand healthcare finds a way. If somebody has PTSD, they're having trouble sleeping, they probably also have a lot of muscle tension and spasticity. If somebody has a need for a medication, you guys have probably experienced this with so many different types of medications that your doctor tries to get you for. People work to be able to come up with the basis to be able to help people get it.
Thank you, doctor.
May I just make one comment about research?
I'm sorry, we're really out of time.
Okay, I respect that. I really appreciate you guys, sincerely.
And I apologize, we just have a lot of big agenda today and a lot of witnesses. Thank you.
I understand. Thank you all.
This time, Chair calls Chase Bearden. Did you have a question? Did she have a question? No.
Hello, thank you. Again, my name is Chase Beard, and I'm with the Coalition of Texans with Disabilities, and we are for the bill. And I wanted to start off by saying thank you for bringing this forward again. I am a current teacup patient. I also represent many in the disability community across the state, and this is one of the topics that we discuss a lot. I think the current program does have some issues, and it comes down to the THC cap, even at 5%. I want to make sure everyone understands the difference. So even with the dose that I'm currently getting, the amount of product I have to buy to actually meet the amount of milligrams dose that I need to take basically means I have to buy more products and then ingest them. So the carrier oil and the other products inside there, after you have to take too much, creates GI problems. And when I mean that, and I'm talking about the disability community, when you're having to deal with stomach issues and you're in a building and you have to run, it's not always the best thing. It does create other issues. And I think the idea of the THC cap, even at 5%, needs to be higher so that the doctor and those in the industry can work to create more options that work for each person. I know I've worked really closely with my doctor on it and my other doctors as we've come forward with them to talk to them about it. And it's made a big difference in a lot of the medications I take. I know, Dr. Oliverson, we've been in front of your committee more than once on pharmaceutical policy. And the one thing we've learned over time is the most affordable healthcare program a state can have is one that helps its patients get the right medications at the right time, because that's what keeps people healthy. And that's basically what we're talking about. Medical cannabis is the exact same thing. It's what got me off of opioids when that was the only legal insurance or way for me to have pain relief and muscular spasms was to go through insurance, and they would supply me with 180 opioids a month. And this is something I had to take for a decade. Cannabis is what helped me work my way down. At that time, though, I had to go to Colorado to get what I need because the program here didn't meet that level. It just didn't have enough of the THC in it. I will wrap up by talking about many of our members that deal with PTSD. It's something in the disability community that's actually very common. There are a lot of extra stressors and a lot of issues that happen to people over their lifetime. We ask that it not just be for veterans. There are many civilians that are struggling to go through PTSD, and it's something that isn't just given as a label. It's something that takes a lot of work between the doctor and the patient, and we ask that y'all help with that. And we really appreciate your time. If there's any questions, more than happy to take them.
Thank you very much. Members, any questions? Representative Weiner?
Thank you so much, Vice Chair Guerra. Thank you for being here, and also just a general thank you to the community here, because I know a lot of folks were also up late with us last night in criminal jurisprudence, and now we're here again. I want to make sure I understand something you said. So under the current law, and actually this proposed legislation, as I understand it, it's the limit is the percentage of THC in the product. Is that correct?
Yeah, by weight. So, you're basically, you can have so much THC, but you need that extra weight. So it'll be filler and CBD. That extra oil or other products is what causes a lot of the side effects.
Okay.
So
there's not a limit on the amount of product you can take with the amount of THC, but there's a limit on the percentage in the product.
Yes, and that, besides the amount of cost, because you have to buy more and more. So it's like if you went and got an antibiotic that they could only put a tenth of what you needed in each pill, you would have to buy 10 pills to actually have one dose. And that's basically what we're having to do. We don't do that with any other medication. So having that flexibility, or even building in more flexibility like we've done with the rulemaking process for the diagnoses, is having those discussions also outside of here where that could be adjusted if need be, and looking at just functional need versus just the diagnosis. Because for many people, it is, like the very first doctor said, you're dealing with the actual symptoms. And if you can get those under control, a person can then take care of the other issues they're dealing with. So I really would, over time, suggest that we look at how doctors can help someone with the symptoms versus just a diagnosis.
Thank you.
Thank you.
Thank you. Members, any other questions? Thank you for your testimony.
Thank you, Chair Click. Thank you so much. Thank you all.
At this time, the chair calls John David Carrasco. Please state your name, position on the bill, and who you represent.
My name is John David Carrasco. I am for the bill, and I am the president and CEO of CanLive, Inc., and also chair the Cannabis Caucus for the Texas Democratic Party. And I've come here today to support the bill and also to talk a little bit, not only from a professional perspective, but also a personal perspective. Back in 2014, my father passed away from cancer, and I began researching what cannabinoids were. I went to Denver, began studying the plant, and discovered the other components of the plant, not just THC, but I found that using a combined use of cannabinoids, me personally, I was able to discontinue all pain medications I had been on for over 10 years, as well as any Valium and Xanax that I needed to sleep with at night. So that really, really helped me. And that was I started my company in 2015. In 2016, Representative Click, you and I went and toured Johnson & Johnson Labs in Houston, Texas. And that research that was presented that day was the CBD that my company provided for that research. That began a chain of events where we were offered an amazing strategic partnership with the world's top cancer facility at a cost of $10 million. The project failed, and there was two reasons why. One, the rules and regulations for cannabis cultivation were not there yet. And two, banking issues. As we met with investors and companies that wanted to get involved, as soon as they stated, yes, we'll put in $1 million, we'll put in $2 million, as soon as they went back to their banking institutions, they said, you give 1 penny to cannabis research, we're going to shut you down. And we found that occurrence to happen in various different scenarios. Now what I'm having to do is take my research out of the country. I'm now duplicating what we did here in Texas. I can't do it in my home state, but now I have to do it in Latin America, where it's being received extremely well with banking cooperation as well as pharmaceutical cooperation. So the answer is, yes, I'm in support of this bill, but there's still so much more work that needs to be done to be able to address and create solutions for research with cannabinoids. Thank you very much.
Members, any questions? Thank you for your testimony. At this time, Chair calls Lisa Sewell. Please state your name, your position on the bill, and who you represent.
Good morning. My name is Lisa Sewell. I'm for this bill, and I represent myself and my family.
Thank you.
Thank you, Chair Click, for continuing to support the Texas Compassionate Use Program. We do appreciate it very much. My husband is HIV positive. He's been positive for 23 years. The father of my child suffers from severe PTSD from Iraq, and my mother struggles through the opioid epidemic. One of my concerns about this bill is it's not including HIV, AIDS, or wasting syndrome. Cannabis directly assists HIV patients by way of neuropathic pain, diarrhea, depression, and an appetite stimulant. As a caregiver to my husband, it's difficult to get him to eat. His morning routine is hard because he's sore from losing his muscle mass at a rapid rate. To clarify, wasting syndrome is the unwanted weight loss of more than 10% more body weight, but it's also common in cancer patients. HIV neuropathy is also a frequent complication, which cannabis has helped replace the use of nerve blockers for him. He deserves a life of value. You know, cannabis helps his mood, his routine, and his appetite, and it does not affect his antiretrovirals. Over 30 states that have a medical program include HIV. Texas does not. However, this bill is great because it does include the authority for the Department of Health Services to add new qualifying conditions through their administrative rulemaking process. So we do support this bill. It also includes veterans with PTSD, which we as a family desperately support. It also includes chronic pain, which will help many patients curb the use of prescription opioids. A few key notes is it does not include parental protections, which is a concern of our families because we don't want to break the law. I'm here to answer any questions of the committee. Thank you for your support of the bill.
Thank you for your testimony. Members, any questions? Thank you so much.
Thank you.
This time, the chair calls Charles Sewell. Please state your name, your position on the bill. Please state your name or position on the bill and who you represent.
I'm Dr. Elias Jackson. I was just delivering something to her.
Oh, I'm sorry.
Charles Sewell? Charles Sewell?
Charles Sewell?
No, he's not here.
Amanda Hall? Please state your name or position on the bill and who you represent.
Hi, I'm Dr. Amanda Hall. I'm the Associate Commissioner for Community Health Improvement at the Texas Department of State Health Services, and I'm here as a resource witness on the bill this morning.
Thank you. Members? Thank you.
All right, thank you.
This time, chair calls Gregory Fowler. Gregory Fowler.
Patrick Pope.
Patrick Pope.
This is Charles Sewell. After Patrick Pope, we'll go back to Charles Sewell.
Okay, Patrick Pope.
Is this Mr. Fowler?
Okay, please state your name, position on the bill, and who you represent.
Hi, my name is Patrick Pope. I am here in favor of HB 1535, and I'm testifying on my own behalf. I am a media content producer in Texas, and 3 years ago, I started a company that simply focuses on cannabis. It tells the story of cannabis in Texas and the world. Living in a prohibition state, it was my goal to just start telling the positive stories that I knew about already and that I was wanting to find in Texas. And sure enough, as soon as I started looking, I found them. I have recorded and filmed people that were so broken down from cancer that they took 2 puffs of a joint and could walk again and hadn't walked in weeks. I've met a man who cured his throat cancer with Rick Simpson oil, a THC concentration oil that cured his cancer. His doctors will testify to this. And I have been with veterans, a group of veterans that sneak across the border to Oklahoma, yes, our little brother Oklahoma, to get their medicine of choice. I've watched them consume their medicine and ease their stress and their fears and their PTSD. One thing that all of these people had in common was that the THC they consumed was well over 5%. It was up to them to choose. Now, I am for this bill. I am for moving from 0.5% to 5%, but I am asking you to consider raising the cap, especially with veterans. Give them the right to choose their medicine and the amount of THC that they want to take in so that they can heal their brains, their hearts, and be one with us as they have already served their country. Oklahoma is also passing laws now that will make them a sanctuary state. So any Texan that wants to get medicine and choose their medicine for themselves will be able to go to Oklahoma and quickly get medical access. And I just want that to be addressed because it will be one more opportunity for Texans to leave this state to get this medicine that they want. I appreciate your time. I'm all for this bill, and I really, really want you guys to make history again. And Representative Glick, thank you so much. Click, thank you so much for writing the bill.
Members, any questions for the witness? Thank you for your testimony. This time, Chair calls Charles Sewell. Please state your name, your position on the bill, who you represent.
I am Charles Sewell, if I may. I am Charles Sewell. I am for 1535, and I speak for myself. I speak for myself and the unheard 95,000 other Texans currently living with HIV and AIDS. I don't want to be a criminal. I depend on cannabis to stay alive. I was told maybe a couple of years ago that there just wasn't enough research to include HIV and AIDS. So I went home and compiled this notebook. Some of you may already have a copy. That is all about how cannabis benefits people with HIV and AIDS. This is even outdated information at this point. I also was recently diagnosed with wasting syndrome, HIV-associated wasting syndrome. I have lost 45 pounds. I have lost so much lean muscle that without additional medication, I am not able to stand up. I'm barely able to work. I had shooting fire going through my entire arm if I had lifted so much as a finger. Again, there is specific research. A couple of my favorite points out of this notebook, University of Michigan used 900 patients to show how cannabis specifically slows the progression of the virus in the human body. That's really the only information I needed to justify in my own mind using cannabis. There is also something from the University of California in San Diego that specifically with the wasting syndrome, how it alleviates a lot of the neuropathic pain. It's gonna help me be able to eat again. It's gonna help me get my weight back, hopefully be able to go back to work so I can provide for my family and for my daughter. I really do appreciate your time. I hope you will include HIV and AIDS on 1535.
Thank you, members. Any questions? Thank you, sir, for your testimony. This time, the chair calls Gregory Fowler. Please state your name, your position on the bill, and who you represent.
My name is Gregory Fowler. From Midway, Texas. I represent myself and my daughter and my family, and I'm neutral on the bill. There's a lot of things that I like about this bill, but one of the things I'm concerned about is still the list of qualifying conditions. My daughter, Stacy, has Tourette Syndrome, which is a neurological condition that's characterized by uncontrolled repetitive movements and vocalizations called tics. The severity of tics can differ from patient to patient and can range from barely noticeable to completely debilitating, like in the case of my daughter. And just like Huntington's disease and Parkinson's disease, The basal ganglia is the area of the brain that is affected by Tourette syndrome, and therefore, excuse me, a lot of the symptoms and sometimes the treatments kind of overlap. In 2019, the state of Texas adopted a list of qualifying conditions that included both Huntington's and Parkinson's, but it didn't include Tourette syndrome. It also included any incurable neurodegenerative disease, excuse me. And Tourette syndrome is an incurable neurological condition, but it's not neurodegenerative. It's considered to be neurodevelopmental. So again, her diagnosis didn't meet the criteria of the qualifying conditions. But medical cannabis has changed her life drastically. She used to live a very limited life with very little socialization. She had many trips to the hospital, and it was just not a very good condition for her. She's now 18. She's been using medical cannabis for the last 3.5, almost 4 years, and she's about to graduate high school. She's been accepted to A&M. She's going to start there in the summer. She's very active in our community. She has active roles in 4-H and FFA, in the church youth group, and with the Tourette's Association of Texas. The problem is this list of qualifying conditions just still won't cover her. And I think we shouldn't move forward on any more medical cannabis issues unless we're gonna just leave the decisions up to the doctors for them to treat the symptoms and not necessarily the letter of the diagnosis. Thank you.
Thank you so much. Members, any questions? And congratulations on your daughter going to A&M.
Thank you. We're very excited.
Yeah, I bet.
Bringing a family tradition.
Yes, sir. My daughter went there and graduated from there as well. Thank you. At this time, Chair calls Sean Meredith. Did you hear that? Okay, at this time, the chair calls Dr. Elias Jackson.
This is the man who just came up and gave testimony. He just needs to state his name and who he represents.
Yes, sir. Please state your name, your position on the bill, and who you represent, sir.
Yes, I'm Dr. Elias Jackson. I represent Beer Farm Enterprises out of Houston, Texas, in the Texas Medical Center. I am for HB 1535, and what I would like to do is also offer an amendment to this particular bill. So I'm coming to you as a father. My son was diagnosed in the spectrum of autism. I'm a traditional trained scientist, graduated from UT, went to Yale. And when I was offered those opioids to give to him during his developmental stages, I began to transform and look for alternative medications. To that end, I began to develop technologies around the evaluation of cannabis for human consumption. In 2014, my company was awarded the only federal patent for the evaluation of cannabinoids and cannabinoid-based products for human consumption. So I stand to you also as an expert in this area. And I think that if we add just a couple of language in reference to certification of these products, we can really cure all the issues. I'm also an advocate for many of the veterans, many of the organizations like NORML, RAMP, those organizations that want to remove the cap, and I completely understand. However, in order for us to do that, we have to include a certification program within this. Remember, this is an active pharmaceutical ingredient. We cannot have bad players selling product along with our legal players, such as compassionate cultivation. By addition of trace track and certification for public health language, you actually create a win-win across the board. One, DPS has more transparency in their law enforcement and being able to recognize the bad players. Two, you as lawmakers have more informed information as you begin to make decisions. Three, you have the ability now to actually give the data to those proposed review boards as they begin to look at research. Four, from an economical standpoint, you now begin to really be able to capture the potential or the predicted revenues for the state. And finally, for compassionate cultivation and all of the other legal growers and dispensaries, by enacting trace track certification language, you now make your product the best in the nation.
Thank you so much for your testimony. I'm sorry, time's out.
Thank you.
At this time, the chair calls Sean Meredith. Thank you so much. Please state your name, your position on the bill, and who you represent, sir.
My name is Sean Meredith. I'm representing myself, testifying in support of House Bill 1535. Thank you, Representative Click, for bringing this issue here today. In 1984, I suffered a spinal cord injury in a construction accident. It's led to 5 months of hospitalizations, complications, rehabilitation, and also a lifetime of pain. Had to relearn how to do absolutely everything. And one of the, in rehab, and one of the things, they give you a lot of pharmaceutical drugs when you have a spinal cord injury to manage the pain and the spasticity. I quickly realized that this was actually detrimental to my recovering from the injury, just all the side effects of these drugs. And a lot of the ones that are commonly used for spinal cord injury have terrible side effects. I consulted a rehab medicine professional, and they told me of people that had used cannabis to, manage some of the symptoms of their spinal cord injury. And I looked into it and found out that cannabis had an almost immediate effect on calming the spasms and also dealing with just muscle and joint pain, and especially nerve pain, which is very hard to treat. So I was able to quit using these pharmaceuticals and really gain control of my life and, get on and go to school and, become a productive member of society. Cannabis is a safe and effective alternative to many of these prescription drugs used to manage SCI. People should not face criminal penalties for medicating in the way that they see fit. I support expansion of the Texas Compassionate Use Program and House Bill 1535, but I would like it to offer more room for doctors to determine who is eligible and what the dosage is and the methods of administration. I ask for your favorable consideration of House Bill 35, and thank you for allowing me to testify here today.
Thank you so much, members. Any questions? Thank you so much.
Thank you.
At this time, the chair calls Renee Bettis. Okay. At this time, the chair calls Eric Espinosa. Thank you very much. Please state your name, your position on the bill, and who you represent.
My name is Eric Espinoza. I am the Deputy Director of DFW Normal, and I am for this bill. I represent DFW Normal and myself as founder of Cannabis.fit. I stand before you here today because of cannabis. In 2017, I went CBD only to try to see if this program would work for me before spasticity was a condition. I was able to get rid of all of my opioid medications, and I have been pharmaceutical free since 2017. During that time, I also realized that THC is a vital part of my medication, and CBD only or low THC CBD medication is not enough. I stand here before you also a 10-year advocate for medical cannabis. 2021 marks the decade mark of my activism of coming to the Capitol and asking and pleading for a proper medical program to be installed here in Texas. The Texas Compassionate Use Program is compassionate, and I'm glad for those that get to use it. I myself suffer from cerebral palsy, which is a spastic condition, and neuromuscular as well. And even though I qualify for the TCUP due to spasticity, I choose not to enroll myself because I know that it would be too costly with not enough benefit for my condition. In 2017, through the use of cannabis, I was also able to compete as an amateur bodybuilder, which is something that I didn't know I had in me. But getting off of the medications and being able to be somewhat pain-free led me to that goal. Also, as Deputy Director of DFW Normal, I have seen thousands of patients, children, and parents ask me every day, when is my child going to qualify for TCUP? When am I going to qualify for TCUP? I am in favor of this bill because I will never go against something that could help anybody in the cannabis community or any patient. But like many others here today, we need expansion. We need a THC cap lifted, and that conversation needs to be between myself and my doctor, just like all the opioid medications that I was prescribed since I've been the age of 12. They can talk to me about the milligram of opioid they want to serve me, but they can't talk to me about the percentage of THC that's in my medication.
Thank you, Mr. Espinosa.
Thank you for your efforts in expanding cannabis here in Texas, and I hope that it doesn't take another 10 years of me coming up here to get a program that I am proud to be a part of.
Members,
Thank you very much.
I'm sorry. Members, any questions? Thank you, Mr. Espinosa. And God bless you, sir. At this time, Chair calls Estela Castro. Please state your name, your position on the bill, and who you represent.
I'm Estela Castro, and I represent myself, and I'm for the bill. I'm here today to testify in support of the extension of the current TCUPS program. Back in 2015, I was diagnosed with interstitial lung disease, also known as polymyositis. The polymyositis attacks my lungs, which causes upper dorsal pain and causes severe pain. Therefore, the doctors have prescribed opiates. And the opiates caused my delay in breathing. I've been traveling back and forth with my daughter to Vegas for the last 3 years to train. While in Vegas, I discovered this amazing medicine called Rick Simpson oil, also known as RSO. I found that when I use RSO, I don't have pain or inflammation. It is gone, and I can breathe, unlike when I'm prescribed opiates. The prescribed opiates only cause the delay in breathing and are highly addictive. Please, I ask you to remove the cap. And I was told by the Compassionate Care Program that I do not qualify, even though I've had 2 pulmonologists that have told me I'm terminally ill and need a transplant. So I am not allowed to use the Texas Teacup program. So when I take opiates, I have to be on more oxygen. I have 3 children and I want to live. I don't want to be on opiates. My pain management has tried to get me in the Teacup program for 4 months. I was told I don't qualify. So he prescribed me Marinol that doesn't help me, that is synthetic. So I please ask in this consideration. Thank you.
Thank you so much for your testimony. Members, any questions? Thank you. At this time, Chair calls Ms. Williams. Mr. Williams, I apologize. Please state your name, your position on the bill, and who you represent.
My name is Jesse Williams. I am here representing myself, and I am for 1535. First off, I want to appreciate the work that you've done, Chair Click, with doing this. I understand there's a lot behind the scenes that's going on that a lot of us don't know about. And I made some friends since this last session, and some people have clued me in on some things, and I really appreciate what you've done. You really put your neck out there on this, so I thank you for that. I'm a retired Navy petty officer. I did nuclear power plant operations for 6 years. And during that time, I tell people I burned the candle at both ends, 80-hour work weeks. I wound up with rheumatoid arthritis, and just like the lady before me, I have chronic interstitial lung disease. It ain't the best thing. I ain't fond of having it. But I appreciate that we're expanding this program, and we can actually get people like myself off of things like tramadol. Because apparently the new wave is let's give everybody antidepressants for chronic pain. I've been through so many medications at the VA just for pain that would normally be prescribed for a mental health condition, and there's no results to it. And they wanted to throw me on tramadol. I've been on that before. The withdrawals are horrible. I wouldn't wish that on my worst enemy any day of the week. I think something we do need to start talking about, and I understand it won't happen this session, but we talk about lifting the THC cap, and talking to a family doctor in a state where it's legal was telling me something I know Chairman Click can relate to, and that's that in medicine, there's a lot about dosage rates. And when we talk about percentage is more for something of THC flower. We don't have a flower program in the state of Texas. We have a concentrate program. And for doctors, dosage rates are everything. When you give them percentages, it's a weird formula they've got to come up with to try to figure out how they're going to give a dose to a patient. So we at least at minimum need to start having the discussion of how do we switch away from a percentage-based program to a dosage-based program. So how many milligrams or let's say milligrams alone does a patient need? And I think that's what some of the patients earlier are trying to relay. So yet again, I thank you that you're willing to work with us on this bill, and I appreciate the time that you've given us to speak on this.
Thank you, Mr. Williams, for your testimony. Members, any questions? Thank you, sir. At this time, the chair calls Ariane Williams. Please state your name, your position on the bill, and who you represent.
Hello, my name is Ariane Williams. I represent myself. I am here to say thank you so much for this expansion that you are doing. I've been a nurse for 14 years. I am master's
Excuse me, ma'am. And your position on the bill?
I approve. I support it.
Thank you.
Thank you. I thought I said that. I apologize. Anyways, I'm master's educated, and I'm also educated on the endocannabinoid system and cannabis therapeutics. And I wanted to speak on some of the things like what they were talking about with the cap and moving from a percentage to a dosage base. I think that the cap, when we're trying to do that and stay in that, these patients are getting more carrier oil than what they truly need, and we're causing more symptoms, more side effects, and that's counterproductive. I also wanted to speak on PTSD. I'm so grateful to see that that's been added. My only thing is that PTSD does affect more than just veterans, even by definition, you know. And right now, with the pandemic that continues to go on, a survey was released from Yale earlier this year that talked about how the survey they did, a quarter of the nurses qualified for PTSD, 50% of them would have qualified for alcohol dependence. And I realized that as nurses, like with the metabolites and stuff like that, we're kind of limited But we suffer from PTSD as well, no different than people who have rape, traumatic car wrecks that are involved in terrorist events and such. Which brings me to another point, which is patient protections, which is something that needs to be added into this bill. We need to be protected from losing our jobs because of positive metabolites. We need, and not being able, custody issues, not being able to see kids. There needs to be patient protections so that they aren't at risk for this treatment regimen that they're choosing that is effective. The research is there. I read it every day. I spend hours and hours weekly reading about cannabis therapeutics and the things that it helps with our body. Talking on CP, the neuroregeneration and the neuroplasticity that CBD and THC helps. Speaking on pulmonary fibrosis, there's studies that are coming out showing that THC has anti-fibrotic properties as well as CBD. These are all things that need to be taken in consideration when we continue to expand. I look forward to seeing more things being added. And again, I'm very grateful for what y'all have done and the things that y'all will continue to do.
I do have a question. You mentioned basically job protection, retaliation. This is the first I've heard of this. What did you mean by that?
Well, okay, so, I understand, like, working in medicine. I know the doctor that had, a doctor that come up here earlier and that was talking about, there's even a shame discussing cannabis therapeutics in general because there's a target on your back with the stigma that it's, oh, well, it's just about getting high or it's federally illegal. Why are we having this conversation? And there's a level to it that's uncomfortable. I've had feedback from other nurses who are in total support of this, other members of the medical community, but it's still very awkward to talk about because of the stigma, even though the evidence is there.
Have you know of anybody who's lost their job because they revealed that this?
No, not directly, but I know of job protections as far as, I know that things are going to be a while for medical. I'm talking about other people out there.
Okay.
Because,
So you don't have personal knowledge of somebody losing their job over this?
No, but I do feel as if that it can be a prejudice that's held against based on the positive metabolites that are within the system from using both CBD and THC.
Thank you so much. Members, any other questions? Thank you. This time, the chair calls Karen Reeves. And again, I would like to remind everybody to please don't read your testimony. You can hand it to the clerk. She'll make a copy for us. We want to hear from you. We want to hear from your heart. Thank you very much. Please state your name, your position on the bill, and who you represent.
Good morning. My name is Karen Reeves. I represent myself in the Syntax Community Outreach, and I'm here to support this bill. So I'm for this bill 100%. With the expansion of this bill, I would actually qualify with chronic pain. I may not look like a medical patient, but I've been consuming cannabis for the last 45 years plus. Thanks to cannabis, I'll be celebrating my 60th birthday this June, if I can make it to June. I use cannabis basically right now for chronic pain. I've had 3 back surgeries. And so I use a little bit of cannabis every day. My routine is in the morning. I have where I do a little bit of coconut oil that has been infused with cannabis flower, and I put a tablespoon in my coffee, and I'm able to get up, move around, and take care of my dog and have a little breakfast. And I only consume about 1 gram of flower a day, so that's like a joint. I do little bitty puffs out of a pipe during the day when I'm starting to feel a little anxious or depressed. And cannabis actually, when I first started when I was 13, it helped me. I was antisocial. I had a bad attitude. My teachers hated me. People didn't want to be around me because all I talked about was gloom and doom. But light up a joint and give me a hit, and boy, I'm a happy camper. I love living life, but for so many years, I suffered with such chronic depression. It was hard to get out of bed, and during those years that I didn't have any access to cannabis, I ended up losing 2 children because I couldn't function and take care of my kids. I have 2 kids now that after I started using cannabis, when I turned 30, after I broke my back for the first time, I was able to go back to work. A few years later, I'm trying right now to work twice a week, but I'm on disability since I was 30 years old. And thanks to cannabis, I'm able to be here today, and I appreciate you guys, and I know this is important to so many people across Texas. I do represent myself, but I also represent my community outreach. So many patients across Texas could benefit from medical cannabis, and like so many people here today, the cap on the THC, for me, I'm afraid that wouldn't help me at all. Currently, I am trying some CBD products, and actually it's helping just a tiny bit, just in combination with what I'm taking my flower. And I would encourage you guys to pass to expand the Texas Compassionate Use Program, and especially for our veterans. And I suffer from PTSD from all the horrible medical things that have happened to me during my life. You know, I've had 3 heart attacks. Also, I've had open heart surgery in 2016, and I'm proud to say that. That cannabis helped me get through that, and I was home 4 days later after my open heart surgery.
Thank you so much for your testimony. Members, any questions? Thank you. This time, the chair calls Elizabeth Miller.
That's our last witness. That's the last witness. Okay.
At this time, the chair recognizes Representative Click to close, since there's no further witnesses.
Thank you, members. I hope you'll give this your favorable consideration so that we can help more Texans. Thank you, and I close.
Thank you, Chair Click.
I was told I was called, but there's a delay, so I'm not sure. Elizabeth Miller?
I'm sorry.
I'm so sorry the bill's already closed. We waited and we apologize. I know you waited for a while, but the bill's already closed.
It is?
And she can.
I was in the overflow room. There's a delay on the video.
Just a second, ma'am, please.
She'll have to submit comments on the public comment portal.
You can submit your comments on the public comment portal. Thank you.
Chairman, I had a question real quick. Is that okay?
I signed up to testify as well, and I was never
Should hear everybody that still wants to
The
speak.
last lady was still talking when I walked in the other room. That's
Should
not
allow
right.
everybody here that wants
That's
to
not
speak to speak.
I'm sorry, we're just trying to preserve the record, and we called the last witness and asked for, anybody else, and that was it,
Other
so.
people signed up but didn't get to.
Well, I'm sorry, the bill is closed.
No.
If there's no objection, House Bill 1535 will be left pending. The chair hears no objection. House Bill 1535 is left pending.